I want to welcome today and mention our speakers, and of course mention the editorial that was in the paper, Time to Hail Heroes, Advance Healing. It very much caught my attention, and it was full page, and if any of you have not read it, it was very moving. How do we heal? That's why we have invited these 3 public health professionals from the Capital Area Human Services Agency for accepting our invitation yesterday afternoon. And in light of this situation, we thought it was appropriate. As community leaders in mental health, they have also handled many crises in this community, including Katrina and Gustav, even losing their own office in Gustav, and a number of shootings, of course, unfortunately. We're pleased to have with us today Dr. Jan Kosowski, who is the Executive Director of the Capital Area Human Services Agency, which was founded over 20 years ago, and she has helped to serve and to shape that agency all during this time. Dr. Anita Udolpha, who is the Medical Director and a psychiatrist, and Tanja Miles, who's a community outreach specialist, who also has a radio program on Cumulus, and you may have been hearing and listening to individuals and people in the community who she has been working with all week. She's going to talk a little about that as well. So if you all would just introduce each other, and thank you so much for coming.
Good afternoon. It's a pleasure to be here today, and I really am thankful for this opportunity to be able to make my comments, to get them out to the general public as well as to law enforcement and their families. A lot of people are struggling, as I'm sure many of you are today. I know the media I've been speaking to have felt it, and there's no way to get around the fact that we've been exposed to some really horrific things in this community in the past 2 weeks. And I think the most important message is let's not walk away from this. I think all of us will find ways to cope that will be effective and be positive. I know Dr. Udolpha will talk to you about some of the symptoms to watch for in yourself and in others around you. But I think the message that we really wanted to make sure that we get out is that human beings are very resilient. As Angela mentioned, this community has been through some really tough times in the past. Many times we wondered how we would get through it, but we did get through it. We were stronger and we were better for it. What we experienced in the last 2 weeks has been just an incredible heightening of the violence that we've kind of grown accustomed to in the past many years, where we've had many homicides. We've gotten used to numbers of 80+ people being killed in this community, and I think that this is a real wake-up call to say that all of us as leaders and people who enjoy and love this community need to say that this is a point where we can't go any further. We do not want to let this community sink into despair or fear, living our lives in fear and being stressed out. And so my main message is that human beings are resilient. There are ways that you can move about your day in the next few weeks to get beyond this, and Dr. Udolpha will share that. The people in your life, your family members, your colleagues need you to be vigilant about how they're experiencing the stress, whether it's in a productive way or in a negative way, but also that we use this as an opportunity to really reset what we think is acceptable behavior in a civilized community. This is a great place. I've lived here for 27 years. People that live in Baton Rouge love this place, and I think that it's really important for all of us to understand the role that we play in getting through this and getting the community to be in a better place than where it was even 2 weeks before all of this happened to us. Some of the things that my agency does is we've always worked very closely with law enforcement. We provide crisis intervention team training to them and have done that for about 12 years now. So we are very close with them, and we're working through their chaplaincy at this point to offer support and therapeutic approaches to law enforcement and their family members. You can imagine how stressful it is for them right now. We continue to work with them as they ask us to go and meet with members of families who have been directly impacted, as well as officers that are on, enormous stress of 12-hour shifts with very little sleep in between. But Capital Area's role isn't just there to work with law enforcement. As Angela said, we've been around for 20 years. We offer services for mental health, addictive disorders, and developmental disabilities. We continue to operate through all sorts of crises, and yes, even when we've lost our facilities. We have a website that I have gone through a number of documents that are made available through other communities that have gone through this type of experience, so that I really would encourage you to look at those links and to take a look. I pulled about 7 different articles that relate to what are some of the needs that other adults may have, as well as how to talk to children, whether it's your child, an adolescent. There are different ways to approach this. I think it's very important for those of you in the media to understand the stress that you're feeling and going through. You're continuously trying to keep yourself up to date on what's real and what's not real, and that's important, but it does have an impact on you as well. So I guess my main message is that at this point, we have an opportunity to get through this together as a community and come out stronger. We can provide support through providing information like the downloads on our website. We'll be having some community opportunities for education that will be at lunchtime, probably Tuesday and Thursday. And then Thursday night, we'll have a repeat of one of those, and that is how to deal with trauma, stress, and get through it. And I have social workers that will be doing the presentations, as well as social workers who will be in the audience that can talk with people that feel a need to get some help right then and there. Our main clinic is on Government Street, 4615 Government Street, and we have a walk-in process that people who feel they need to come in and see a professional, we encourage you to come in. We will find a way that you will be seen. You will certainly not leave without being seen by a social worker and having an ability to express what your needs are. At this point, we just want to make sure that the public is aware that we're available. Please use the information that we've provided to you. As I said again, most people will not need to come to a mental health center, but we do need to be monitoring ourselves and others around us in terms of how to get through this time and be productive moving forward. So I'm going to go ahead and introduce Dr. Udolpha. She is the Medical Director at Capital Area Human Services, and she'll be talking to you about what are some of the signs and symptoms within yourself and others around you, and when it is time to go seek professional help. Thank you.
Good afternoon. I want to start by saying thank you for inviting us to this program. And I will also add that my thoughts and my prayers are with the family of the persons that were killed, anybody that was killed in Baton Rouge, the police officers, Alton's family, Dallas, and all over the country where this has happened. And of course, when something like this happens, it's something that touches all of us. One way or the other, it touches us. And so there's all kinds of ways that we'll react to serious problems like this. A lot of people will find that they are thinking about it way more than just a little bit out of normal. I mean, it's something that we have to kind of think about. Again, at this point in time where it's the news cycle, social media, all these things has made it possible that this news gets to you even before you know it. I was surprised yesterday. I'm from Nigeria. I did not even know that it happened until I saw a text from Dr. Kasavsky. And somebody called me from Nigeria and said, "Are you okay? I'm watching the news in Baton Rouge." And it was very surprising, but that's what social media has done to things like this, that family members that may not have known what was going on, they're aware of it. Everybody's worried for their family members. Everybody's trying to find out, are you safe? Where are you? And so when we have a disaster like this, there's all kinds of feelings, all kinds of emotions that going to come out. There's a lot of guilt. Some people might even feel guilty that is there something they could have done to prevent what was going to happen. But sometimes there's nothing anybody can do. Some of these things, nobody knows what's going to happen. There's only so much that anybody can study a group of person or people to try to find out what's going on. Sometimes things like this just happen without anybody really being aware of what's going to happen. And so what we encourage is that you find somebody reliable, somebody that you can talk to, talk about what's going on, somebody that you can share your feelings safely and efficiently. So we encourage that people talk to family members, loved ones, the church. A lot of churches right now, a lot of pastors are educated and trained in being able to counsel their members. And there are a lot more people that in the first place go to the pastors and talk to them. And so if you get to the point that you know that you've talked to people, but you're still getting to the point where you're not able to sleep, you're becoming very emotional, you're becoming very stressed out, your sleep is being affected, those are signs that you start kind of worrying about. You're not able to focus at work, you're finding yourself being sick and not really knowing what's going on. At that point, I think we really do encourage that you find a mental health professional and try to get some help. Get somebody to talk to you, somebody to kind of process your feelings with you, and that is always very helpful. And there are a lot of children, again, because of social media, that are aware of what is going on. And of course, the children are very scared. There's some of these children whose parents are police officers, even in the hospital. They have parents that they now started worrying, will my father come back alive? Will my mother come back alive? And so it's very important for you to sit down with your child, try to find out what your child is aware of. What has your child heard on the social media circles? It's amazing to realize that sometimes social media can affect our children much more than we ever realize that it's possible. I'll give an example of, I think there was something that happened like that, and my son came and I just found that suddenly he wanted to be sleeping in our room. He didn't want to go to his room again, and we had to sit down and talk to him, try to find out what was going on. So you need to talk to your child. Try to give them the answers and what is going on in very simple language. Allow them to understand that they can come back to you and ask questions that they don't understand. Of course, you should not, as much as possible, you should also probably control some of the things that you say. If you know that some of the things that you say will be a little bit scary to the child, then you have to kind of watch that. It's also advisable that you limit social media, cut down on how much TV the child is watching, because the child could start re-experiencing it. The more you watch it, the more you feel like it's happening all over again. And so it's very important to do that with your child. If you talk to your child, give your child as much comfort as possible. Be willing to be there for the child. Keep checking to see what's going on. Let the child understand that, we're as safe as possible, but sometimes life is such that nobody can truly understand, but you're doing everything that you can to protect yourself and keep yourself safe. And if it gets to the point that the child is continuing to probably start acting out, the signs that you now find with the child that is now it has passed just a mild level of problem will be that the child is not able to sleep, the child is acting out, the child is being more irritable, just not focusing, not doing well wherever he or she is. I think at that point you need to talk to a mental health specialist and get some help for your child. Counselors available. Like Dr. Kasavsky said, we at Capital Area Human Services District, we have adult services and we have children's services. We even have services in the schools. We're in 32 schools in East Baton Rouge Parish and the 7 surrounding parishes. So we have social workers in the schools. So if your child goes to any of those schools, one of our social workers can talk to them. Otherwise, they can come to our clinic on Government Street. We have another children's clinic in Donaldsonville and another clinic in Gonzales. We have adult clinics in the 7 parishes, so they can come to any of our clinics, and one of our mental health specialists will talk to them. I hope this has been helpful, but please, even for the news people, I think those in the news media sometimes might not realize the impact that comes also on them. they are continuously watching some of this thing. They're taping, they're filming, they are in the center of the action. You have to take some time for yourself. It gets to everybody. I don't think there's anybody that is too strong and could say, no, this doesn't have any impact on me. It does have an impact on everybody. And so it is very important for you to take some time to yourself, talk to somebody. If you think it's getting too much, take some time off. There's nothing wrong with asking for, even if it's a couple of days off, to talk to somebody and just try to kind of process what's going on around you. And I think that would be very, very helpful. Thank you. I'd like to introduce Ms. Tonya Miles, who's a community specialist. She's very good at what she does. She helps a lot of our clients to navigate our system. Thank you.
Good afternoon. Thank you so much for having us. We're in times like these, we all need each other. Doesn't matter the color of our skin, what our background is, how much money we make. It's all about our community. And right now, our community is hurting. But the cool thing about it is that we are from a strong community. We have good people in this community, and we will be resilient. We will bounce back from this. But right now is a time of grief. Of time of people trying to process this. At Capital Area Human Services, I am fortunate that I get to help people every day who are in crisis. Most people who come through our door are in crisis of some kind of challenge that they're having in their lives. And one thing that I tell them, the best care is self-care. And one of the things that I'm always reminded of is that when we get on a plane, they always tell us, and I'm paraphrasing, in the case of cabin pressure, we're to put on our own mask first before we do that of someone else, which I thought was pretty goofy. I'm like, if I have a niece or a nephew, because I don't have any kids, I would want to put their mask on first because I love them and I want to make sure they're taken care of. But in order for me to be healthy enough to take care of them, I must first take care of myself. At Capital Area Human Services, I do serve as a community outreach coordinator where I'm out telling people that there is hope, there is help, there is healing after a crisis. Each and every one of us have been probably through our own different crises, being a loved one passing, financial crisis, it doesn't matter. A crisis is a crisis. But the thing is there is help. And at Capital Area, we strive on making sure that we have the right professionals in our offices to make sure that when people come through our door, they get the help that we need. As a community organized specialist at Capital Area, I'm excited that I get to push that message of hope, that there are people who are qualified, who are called to do this, to help people, guide them through the crisis that they're in. And right now, like Angela said, that I also have a radio show on Cumulus, and for the last 2 weeks, I've been interviewing a bunch of our elected officials, community leaders, and right now their biggest thing is how do we get people the help that they need. It's taking an emotional toll on them as well, but what about the other people in our community? How we get that information out? And here at Capital Area, we're going to make sure we get that information out to people. We're going to offer them the help that they need to get through these trying times. We will get through this. We all grieve differently, but the bottom line is that we're strong, we are resilient. Fortunately, I knew one of the officers who passed. Unfortunately, it's sad to say that, I miss him, dearly. He was a good man, as most police officers, I believe, are, to protect and serve. There might be some ones who people, have questioned, but that's not what we're here to talk about. My background is law enforcement, so they have a special place in my heart. But today, our city is grieving, and we need to come together as a community. We need to say that, we will get past this. Have conversations with, the people that you work with. Have conversations with your neighbors. Have conversations with people in your family that you just might want to check on them. I also have a diagnosis of post-traumatic stress disorder, and I know that I have a tight-knit family that I'm accountable to. We all should be accountable to somebody. I'm also a vet, so a lot of these things that are going on, they affect me, internally, but I know that I have to take care of myself first. And a lot of times people think that, I'm strong enough, I can handle it, but like Dr. Udolpha said, if you keep seeing it over and over again, and like Dr. Jan said, our community had some challenges way before this happened. And I think now is the time that we have these conversations on how do we get past this. And so my thing is that we are resilient. We will get through this. One day at a time, sometime one breath at a time. But at Capital Area, we have the people who can help, our community get past this. It's just amazing that, Dr. Jan has reached out to others in our community, such as the Baton Rouge Police Department, the Sheriff Department, working with their clergy, working with those families. Those are the type of things that we do at Capital Area. Those are the type of things that, we don't wait for a crisis to happen. Unfortunately, like I said, people who walk into our clinics, they come into crisis every day. So we stay in a mode to help people, be the best that they can be. Like I said earlier, the best care is self-care. And that's one of the things we strive every day to make sure that people know and give them the tools that they need to make sure that they can take care of themselves. But here's the deal. I know that you guys do great work every day, and as I take my seat, I just want to encourage you, take care of yourself. Hug a family member. Talk to your kids like Dr. Udolpha said. There are many ways to talk to children. Your house is different from mine, so you'll find a way to do that. But at Capital Area, we're going to strive every day to make sure, not just during this crisis, but every day that we meet the needs of the crisis issues or trauma issues that people in our community. So again, I just want to thank you for having us. Again, as I go to my seat, I want to say again, the best kind of care is self-care, and it starts with each and every one of us. And when we begin to take care of ourselves, our families, our community, our country becomes stronger. Thank you.